Did you know there are certain diseases that require blood transfusions on a regular basis in order for that person to survive? These people solely rely on us, the donators, to give blood. Some of these diseases include anemia, liver disease, cancer, and bleeding disorders. I found a story on the American Red Cross website that I would like to share with you. My name is Lauren, and I have a rare blood disorder with no cure. The only treatment is blood transfusions. I am 23 years old, and I have received anywhere from 150 to 200 blood transfusions in my lifetime. I would die if people did not give blood, and I will be forever grateful to anyone who has ever donated or will donate in the future. This is why today I urge you to donate blood. It is people like us who make the generous decision to donate blood, and it is our blood that Lauren has survived off of. With extensive research, personal experience of donating blood, and as a nurse, I see firsthand how serious the need for blood really is. Can you imagine a loved one getting in a traumatic car accident and suffering from severe blood loss, and there was nothing anyone could do because our country was suffering from a shortage of blood? So today I will inform you on the importance of giving blood and how it will benefit us. First, I would like to talk about the need for blood. According to the American Red Cross, every 2 seconds someone in the United States needs blood, and more than 44,000 blood donations are needed each and every day. As you can see here, 25% or more of us will require blood at least one time in our lifetime. The reason for the blood shortage is the increased demand due to the increased number of complex therapies such as chemotherapy, organ transplants, and heart surgeries, which all require large amounts of blood and blood products. According to ABC's Melissa McMillan, one liver transplant can use 120 units of blood. You can see here, a cancer treatment can take up to 8 units per week per patient. A heart surgery can take up to 8 units. A car accident or gunshot wound can take up to 50 units. Other organ transplants can take up to 10 units. Abdominal surgery can take up to 4 units, and even a brain aneurysm can take up to 4 units of blood. According to an article written on September 19th by ABC News, the president of the American Red Cross said that this is one of the worst shortages the Red Cross has seen. She said 32 of her 36 regions were on appeal, which means either they have less than a day's supply of blood available, or they simply have inadequate supply to meet the hospital demand. Of the 38% of people who are eligible to donate, less than 10% actually do. Now that you can see there is obviously a crucial need for blood donations, I will tell you the solutions. The more people know how easy it is to donate blood, and once they are educated about donating blood, they will be more likely to do so. The few requirements of donating blood are you must be 17 years of age and you must weigh 110 pounds. The donation process has 4 simple steps. First, you need registration, and then they do a health history and mini physical exam. And then you do donations, and then afterwards they'll provide you with some refreshments. So when you register, they'll just get your basic information, and check your eligibility. Then they will ask you about your health history. And during the mini physical, they will check your blood pressure, they'll check your pulse, your temperature, and your hemoglobin level. The next step is donation. According to the American Red Cross, the actual donation process only takes 8 to 10 minutes. Then afterward, you are given some refreshments, and often they'll give you a t-shirt, like the one I'm wearing today. According to the University of Maryland, common reasons why people do not donate are either I'm scared of needles, I'm too busy, I'm afraid I will get AIDS, my blood type isn't the right type, I don't have enough blood to spare, they won't want my blood. So some reasons why all of these are not true are most donors feel a slight initial pinch, and 8 to 10 minutes later you're finished. So that for people who are scared of needles. This process only takes about an hour, so everybody can spare at least an hour a day. It is not possible to get AIDS by donating blood. A new sterile needle is used with each donor and discarded afterwards. Every blood type is needed daily. If you have a common blood type, there are many patients who need it, so it is in high demand. If you have a less common blood type, there are fewer donors available to give it, so it is in short supply. The average body has 10 to 12 pints of blood. During donation, they take approximately 1 unit of blood. The body replaces the fluid loss within 24 hours and replaces the red blood cells within 6 weeks. There is no upper age limit on donating blood, and many medical conditions do not prevent you from donating blood. As you can see here, only 3 in 100 Americans donate blood, and 1 pint of blood can save up to 3 lives. Lastly, I would like to talk to you about the benefits of donating blood. According to an article off oneblood.org, there are many benefits for the donor. Studies published by the American Journal of Epidemiology stated blood donors are 88% less likely to suffer a heart attack and 33% less likely to suffer any type of cardiovascular event. Also, when donating blood, they receive a free cholesterol test and a mini physical exam that can catch certain illnesses in the early stages. And lastly, they can leave with the satisfaction that their donation has saved 3 lives. The benefits of the recipient include a second chance at life. They know they are living solely because someone so kind donated blood and for that they are alive. The demand for blood exceeds our supply. Blood cannot be manufactured. It can only come from a donator. The donation process is simple, and you get the greatest gift of all, saving people's lives. You can be someone's superhero for a long time by making 1 hour out of your day to donate blood. This is why donating blood is important and why I urge everyone who is eligible to donate blood to do so.